Welcome to Managing Midlife with yours truly, Dr. Patty. We have a show in store for you tonight, and we're going to be talking about mental health awareness. May is Mental Health Awareness Month, and so tonight I thought that it would be appropriate to replay a previous recorded interview that I had with Nancy St. Clair of an organization called Give an Hour. They provide mental health services to military and families of military or friends of military, and they're free mental health services to help support those individuals who may be dealing with mental conditions, returning from active duty or whether they've retired for duty. So I wanted to bring attention to their organization tonight and some of the things that they are doing out there in our community and nationwide. Perhaps you may know someone who is living and dealing with mental illness, who has been in the military or is currently in active duty, or a family that may be currently dealing with some of an individual who is suffering from a mental health condition. And as always, we want that information to be readily available to you as a resource to help you in your time of need and or in the time of need for a friend. So, with that in mind, the first thing that I do want to do tonight is talk a little bit about the prevalence of mental illness, because approximately 1 in 5 adults are affected in the U.S. by some form of mental illness, and that's 43.7 million people, or 18.6% of our population will have some experience with mental illness in a given year. Approximately 1 in 25 adults in the U.S. experience a serious mental illness in a year that may substantially interfere with or even limit one or more of their life activities. And approximately 1 in 5 youth ages 13 to 18 experience a severe mental health disorder in a given year. And so the statistics, as you can see, there are a lot of people that are experiencing some form of mental illness. And just so you know, to break it down a little further, 1.1% of adults in the U.S. are living with schizophrenia. 2.6% of adults in the U.S. live with bipolar disorder. And then 6.9% of adults in the U.S. have at least one major depressive or depression episode in the past year. And here is the big number: 18.1% of adults in the U.S. have experienced an anxiety disorder such as post-traumatic stress disorder, obsessive compulsive disorder, otherwise known as OCD, and or other kinds of specific phobias. And then lastly, among the 20.7 million adults in the U.S. who experience a substance use disorder, 40.7% or 8.4 million adults had co-occurring mental illness, meaning they may have had two things simultaneously. So the numbers are there. And all of us may know someone who has come in contact with someone who is living through or experiencing mental illness, or you yourself may be living with a mental illness in some form or fashion. Not everyone has a chronic mental illness, but many of us do experience stress. Many of us do experience anxiety. Many of us do experience depression.
All right, so welcome to Managing Midlife with Dr. Patty, and we are here tonight with our featured guest, Nancy St. Clair, and she is the Chief Operating Officer for a nonprofit organization that serves veterans and individuals in the military called Give an Hour. And I'm just going to briefly start off to give you a little bit of information about Ms. St. Clair's background. Like I said, she's the Chief Operating Officer for Give an Hour. Nancy has a bachelor's and master's degree in anthropology with a focus on ethnographic studies. Serving as a civilian cultural advisor with the Army, Nancy was embedded with a brigade combat team in Kirkuk, Iraq, for 7 months in 2008 and to 2009, actually. And she was there conducting sociocultural field work, in which she actually did. She accompanied soldiers on missions outside the wire, including infantry units, military transition teams, police transition teams, and the military police. And through this experience, she really gained a profound respect for service members and the sacrifices that they make. And so as a result, she has now dedicated her time to giving back to those who served. She also earned a master's in counseling and has 15 years experience as a licensed professional counselor. She is a licensed associate substance abuse counselor and a national certified counselor. And Nancy is also married to a combat veteran who has served in the Gulf War in Iraq, and Afghanistan. She's also a member of the American Legion Auxiliary and United States Coast Guard Auxiliary, and she also serves as the Family Readiness Group leader for the Army National Guard 430th Ordnance Company unit in Washington, North Carolina. Wow, I hope I did that well. I got through all of that.
You got it.
We are so excited. Welcome to our show. I'm so excited to have you, first of all, joining us to speak about your organization and the services that that your organization offers, especially with this upcoming Veterans Day is coming up, where we, honor those individuals who have served this country, and not just the individuals, but their families as well. So welcome.
Well, thank you. It's an honor to be here, Dr. Patty, and thank you for honoring our veterans and their loved ones. We appreciate it.
Excellent. So why don't we start off with this, because I know that I was, had the privilege of being introduced to Give an Hour, and I want our listening audience to also understand a little bit more about your organization and about the programs and services that you offer to the military and veteran community and their families, because you offer a very important, necessary, much-needed service to that community.
Yes, well, thank you. Dr. Barbara Van Dalen, she's our president and founder. She's a psychologist out of the D.C. area. Back in 2005, she really saw a need. She saw a lot of people that were coming back from Iraq and Afghanistan, and thought, we're going to need some additional assistance to help with behavioral health needs, and it's going to take us as a community and everyone to help assist. And it was in the spirit of that she started Give an Hour, and she reached out to the mental health community, all the major mental health organizations, to the Department of Defense, to Veteran Affairs, and so this is what I'd like to do. I would like to rally our mental health professionals and see if they'd be willing to donate an hour of their time for free a week, hence the name Give an Hour, to provide free counseling to these post-9/11 service members and their loved ones. And that's what she did. And now, 9 years later, we have around 7,000 licensed clinicians across the nation that provide this free counseling to our service members and their loved ones for absolutely free.
Wow, that is phenomenal. know that you're offering that type of service, especially to this group of individuals. When they're coming home, I hear a lot about PTSD, and I hear about some of the things that they're dealing with as they're reintroduced, back into civilian life, the ones that do come back into civilian life, and then also their families, their wives and their children, just the coping and the transition sometimes that they've gone through and experienced. So this is just it's so awesome. It was so awesome for me to hear about a service that is being offered, and that is actually saying that we understand that there are things that you will experience and go through, and we're right here for you to give you service providers in your area that can help you to kind of navigate through that transition. So how many, offhand, just approximately how many families do you think your organization may service or engage with or touch, probably is the proper word, in a year time?
So that's the way that we can really measure that, because we're anonymous. We don't want to know people's names. We want people to access this and easily, and not be scared away because we're gathering information. So what we do to best collect numbers, because we do want to know how many people we're able to assist, is we send out a quarterly survey to our providers, and we ask them in the past quarter, how many hours of time did you provide? And we're dependent on the surveys to find out. So what we've been able to collect to date, and we think it's probably a conservative number, it's actually quite larger, but in the last 9 years, since 2005, we were able to document 144,000 hours of free counseling that have been provided to our service members, veterans, and their loved ones. And if you think about that, Dr. Patty, probably the average counselor charges about $100 an hour for counseling. So if you break that down, that's $14 million of free counseling that have been provided for this population, which is pretty amazing.
It is amazing. And like you said, that's probably just a sample size of what you're actually doing, and a glimpse. Probably only a glimpse of how many you may be servicing. Only because obviously when you send out surveys, you depend on folks to get them back to you and to respond. But even with that, $14 million in terms of placing a number on it is not a drop in the bucket. And that's 144,000 plus people that are getting a service and getting a mental health benefit or service, that they may need for themselves and or for their family.
Yeah, and let me define too how we really think about our service members and the loved ones and who can access the service, because I want to make sure that people are really clear on and that this is for them. If anybody has served post 9/11, it doesn't matter if they've deployed to a war zone or not. If they've been in the military post 9/11, they're able to access the service. So this could be somebody who is either still active duty, meaning they're still in the military. They could be retired. They could have just separated from the military. Perhaps they have an honorable discharge. They could have a dishonorable discharge or a less than honorable discharge. It doesn't matter. If they've served in the military, they're eligible for this. Also, we defined a loved one as anybody who loves someone who has served during this time and has been affected by their time with the military. So this could be someone like a fiance, a mom, a dad, a good friend, who may not be sort of a card-carrying dependent, who wouldn't normally have access to counseling services, that is now able to get free counseling.
Wow, that is great. I like the way you defined the loved one, because that could be, the caring friend or, someone. I mean, wow. I'm just astonished with the information that you're giving me, because I've never heard of I've never heard of your organization before, and I wonder how many people are just out there that may be listening military wives and such, or other folks, friends who may have been affected, or trying to cope with someone who has been in the military or served in a war, and they don't even know that they're entitled to have a service such as this to be able to help them work through some of the mental health things they may be going through. And I just think it's phenomenal. It's literally phenomenal, and I think I found a diamond in the rough.
Well, we thank you for helping spread the word, and certainly for your listeners too. We do want to let people know this is out there and this is available to them. So please help. If it's not for you, maybe you know somebody and let them know about it.
Well, and the other thing that I think that as I've listened to you, even in talking about how you're gathering your statistical information, and really the anonymity component of it, because a lot of people sometimes, they feel uncomfortable about even asking or acknowledging that they need a service, or they feel ashamed that they may need something like this, and just knowing that you don't have to be ashamed, and that the service providers through the network are here to help you and to give you the services or the help that that you may need, without a whole lot of everything, but just kind of putting you in touch with those resources. And depending on their individual circumstance, and their economic position, if they don't have the finances, or they're saying, I don't have money to pay for a counselor, or I can't afford to pay for a counselor, or I'm unemployed, this is another way to say, well, here is another means for you where there's a service that's available for you and a provision that's made available for you, and at no cost to you.
Absolutely, and you raised a really good point, Dr. Patty, about the issue of stigma. I mean, I think that's something that is not unique to the military. It's prevalent in our society that people aren't comfortable with talking about mental health issues. And given that's another thing that we like to promote, that it's a sign of strength to ask for help.
Yes.
And people heal in all different ways. Our president and founder, Dr. Barbara Van Dalen, says, one size does not fit all. So people have a lot of different ways to heal, and a lot of different approaches that they can go about that. And, we just want to let people know that there are people out there that love them and care about them simply because of the sacrifices they have made for our country. And there are people that truly care and want to assist if they feel moved to reach out, and we hope they do.
Absolutely. So let me ask you this. Before I go to the question to inquire about your organization's current initiatives, I want to really talk about or really convey how does your program actually work? Because I did go to your website and I saw that there is, one selection for the providers, and then another selection for those who may be looking for providers or looking for the services.
Yes, so that's the other thing that Dr. Dalen wanted to make sure that we did with GivenHour, that it's very easily accessible. So you go to our website. It's givenhour.org, O-R-G, again, giveanhour.org, and it's really prominent. There's two buttons, like you mentioned, and one is searching for a provider. And you click on that button, and our search engine will come up and ask you to put in your zip code. And then you can also do a specialized search if you're looking for a clinician that specializes perhaps in working with children or couples or with post-traumatic stress disorder or depression. You can do a specialized search for that. So you put in your criteria, and you can also put within a certain mile radius. There's a drop-down if you want to select within 5 miles, maybe 15 miles, 25 miles, and 50 miles. You can also do that. And then it will pop up with the name of providers in your area, and then it's up to the individual to contact the GivenHour provider and reach out and say, I found your information on the GivenHour website, and I'm a service member or loved one. I'd love to get this service. If something happens and you do a search and a provider doesn't come up, or perhaps a provider or two comes up and they're not accepting clients, we do help do specialized matching I will say this works most of the time. We have enough clinicians now that if you do the search, you're generally able to find someone. But if not, you can email us at info, that's INFO, at givenhour.org. And I promise this does not go into a black hole. We have staff that are dedicated, and we'll answer those emails, and we'll help find you a client or find a clinician. That's what they do. And actually, they're really good at matching people.
Right.
And what will happen is they'll reach out to our network and find someone for you and help you through that process.
Wonderful, wonderful, wonderful. So now let's get back to some of the organizations, some of your Given Hours initiatives that are going on, because that's also information that is available on your website and ongoing. And so I just would like to, just let the audience know some of the things that you are doing on an ongoing basis.
Sure, absolutely. Our main mission has been to find more providers to sign up for Given Hour and also match those individuals to people in need of counseling. So certainly if you are a counselor and you're interested in signing up, we'd be delighted to have you on board. And if you're someone who's looking to get these services, we hope you'll reach out and go to our website and do that. We also have a couple exciting initiatives that we've been doing or also are launching. One is an initiative with Google Help Out. What that allows us to do is for our Given Hour providers to provide free counseling via telehealth, meaning over the computer. So maybe you've done that via Skype, talk to some loved ones,
right.
Google Hangouts to do that. Well, Google Help Outs has been able to create a platform. It's HIPAA compliant, meaning it's anonymous. It fits the standards of being anonymous. It's firewall proof.
Mm-hmm.
That if we're Given Hour providers that want to do telehealth, they can contact us and sign up to become a provider through that. Now, this is something pretty new that's starting to happen in the counseling community across the country, and why it's really exciting to us with working with veteran military population is it helps us reach people who maybe otherwise, because of stigma, wouldn't want to reach out. They may be in rural areas.
Right.
Perhaps they've been injured, and so they have some mobility issues, or they're a caregiver taking care of an injured service member, and so they're not able to get out as easily. So it helps us expand that expand our reach through that. So we are starting to gather names of individuals who are interested in doing that. And again, you can email us and let us know if you're interested in becoming a Given Hour provider and through the Google Help Outs initiative. So we're gathering those names and having them, those clinicians go through our system to get signed up so we can match people that way. So please be looking for that to be rolled out too, hopefully by the end of the year. Also, if you're interested in receiving services over the computer, that we'll be able to do a search that way too.
I'm sitting here in awe because I know that I've had numerous conversations over the course of time and just through my counseling in stating, if a client or someone goes to another state or another area, why do I have to lose that client, especially if I've built a relationship with them and trust with them and been working with them, but life events happen that would require them to have to, go away, and you put in so much time, and then they may or may not start over with someone else. But with this tool, even with the military, no matter where they're at, I'm just in awe of the technology and how far-reaching it can be, and how, that just takes your services to a whole nother level of expanding the ability to really reach people where they're at and help them, where they're at. Oh my goodness.
Mm-hmm. Right, and right now it's pretty cool, huh? The laws with that now are as long as the counselor is licensed in the same state as where the individual is located, they can provide telehealth. So that counselor does not have to be in the same state as the individual, but if they're licensed in that state, then that's okay. Yes. And then we also tell people check with your state licensure board, make sure it's okay that you're covered, because different disciplines in different states have different guidelines about this.
That's correct.
But if you're wanting to sign up for that, we provide you with that information and walk the folks through that process too.
Wow. Well, that is wonderful. Well, you know what? We're running out of time, and this is all such good information. But I would be remiss if I didn't direct our viewing audience on the means in which they can contact Given Hour for more information. So if you could give us, if there's a telephone number or 800 number, website, Facebook, Twitter. I'm just trying to cover all the bases of how folks reach out these days when they're trying to touch your organization.
Yes, the best way to reach us is definitely through our website, www.giveanhour.org. You can also email us at info, that's INFO, at givenhour.org. You can certainly like us on Facebook. It's easy to find us under Given Hour. And we do have a Twitter account also called Given Hour. So we keep it simple. You can easily find us. I do hope, again, if this has sparked some interest in you, whether it's for you or a loved one, please help share this information, share the good work that we're doing so we can connect people and help those that are in need.
Absolutely, absolutely. And for our viewing audience, we will leave that information up on the screen for a few minutes just in case you need to, jot it down. But givenhour.org, if you do you can go to their website, and they also have their Twitter and their Facebook, and I think their LinkedIn. All of the handles are there right on the home page, of their website. So please, even if it's not for you, but if it's someone that has served in the military or a family that that may be in need of these services, please pass this information, on to them. The service providers are there, and they're waiting to be able to provide the services that you need. Ms. St. Clair, I thank you so much for your time today and taking a little bit of time to speak with me and to share with our viewing audience a little bit more about your organization and the services that you offer. And I just encourage you, to continue doing what you're doing. And, certainly we are grateful for the veterans and the military who are out there protecting and serving our country each and every day. And certainly, we want to be able to support them and their families to the extent that we can for them being able to serve us. And I don't think that a lot of people really realize the nature and extent of what it's like to, be in the military and to serve our country, or to be in another country where you're protecting us and protecting our borders so that we can sleep at night. And it's a tough job, and it's tough on the families sometimes that are living through these experiences. And so we just want to, at least Dr. Patty and Midlife Resource Center, we're grateful and appreciative. And to the extent that we can help to alleviate or some of the transitions that they're having, we would love to be able to do that.
Well, thank you so much, Dr. Patty, for helping us spread the word. It's been a true honor to be on your show.